morning. Ontario is getting rid of its mandatory 5-day isolation rule. Ontario's top doctor announced today, if you have COVID, you no longer have to stay home, even if you're testing positive, as long as you have no fever and your symptoms have been easing for 24 hours. If you're still testing positive for COVID, you can go back to your workplace, you can go back to school.
That is correct.
Those are the new rules. The 5-day isolation period is out the window. But Ontario's Chief Medical Officer of Health adds, if you get COVID, you should mask for 10 days and avoid going into vulnerable settings like long-term care homes or hospitals. The guidelines are for all respiratory viruses. COVID is now lumped in with the cold and flu.
This is an all respiratory virus approach.
Dr. Moore says vaccination levels, herd immunity, and improved treatment means there can be a more permissive approach to people who catch the virus. He stresses everyone needs to stay up to date with vaccinations and announced boosters will be available to children from 5 to 11 as of tomorrow, days before schools reopen and almost 2 weeks after they were approved by Health Canada.
I know it wasn't quick enough for some individuals, but I appreciate people's patience.
The announcement comes after hospitals have endured a summer under pressure. Dr. Moore acknowledged another increase in COVID transmission is expected this fall. Data from the Ontario Science Table shows wastewater signals have creeped up since mid-August. This ICU doctor was quick to condemn eliminating the isolation period.
A positive rapid test also indicates you're likely infectious, which means you can transmit the disease to other people. In my view, this will enhance the spread of COVID-19 in school and work environments.
The Liberal health critic, who was an ER doctor before he was elected in June, also voiced his concerns.
I'm deeply concerned about this decision to remove the 5-day, the 5-day isolation requirement. But we've got ERs closing, ICUs closing, nearly 1,400 people admitted in hospital right now with COVID-19, and we're not even in respiratory season yet.
Dr. Moore says mandatory masking could be brought back if COVID seriously impacts hospitals. He does not foresee any future lockdowns. Now, cynics might say the timing of this announcement would be to distract people from the Ford government's controversial long-term care bill being passed, which happened today.
I declare the motion carried.
Bill 7 was easily passed by the majority PC MPPs. It allows health officials to push elderly patients ready for discharge from hospital into a long-term care home they did not choose in order to free up hospital beds. Now, critics say that is a violation of rights. In fact, CUPE sent a letter today to the Human Rights Commission asking for an investigation into discrimination based on age.